Hello, everyone. Good evening. Thank you for joining us this evening. Hello. Thank you. Um, Dr. Wumi Ojo, thank you for joining us this evening. We really appreciate you. Thank you. We are going to start at 7 o'clock on the dot. We still have about 2 minutes to go. Nina, you're welcome. Pastor Joe, welcome.
Evening, ma'am.
How are you doing?
Good evening, I can't hear you.
All right. Okay. Can you hear me now?
Yes.
You can't hear? Okay.
I can hear.
You can hear? Okay. Wumi, how far? Can you hear me? I don't think so. Who else is there? Nina, can you hear me?
Yes, I can hear you, Pastor.
Okay. Good. Dr. Wumi, it's you are not hearing me.
I can hear you, ma.
You can hear me? Okay, good.
I can hear you now, ma, yeah.
Okay. How are you? Thank you. Good to see you. I appreciate you. I know you're a very busy woman. Thank you for taking time out to join us this evening. Yeah, it's 7 o'clock and we are just going to kick off. Dr. Aino had said to me that he's on call today. He would join us as soon as he's able to. Yes, since we have just an hour, we are going to crack on and then let those who are joining in then catch up with us. Oh, Dr. Aino is here already. Dr. Aino, okay, here you are. How are you? Okay, can you hear us? Hello, we can hear you. You are muted.
Yes, I can.
We just walking. Okay. Good evening. Thank you for joining us this evening. We appreciate that as medical practitioners, you guys are extremely busy, but we are grateful for this opportunity to be here. So we'll crack on. The purpose of this conversation this evening is really to discuss amongst the Bame community in terms of the impact of COVID-19 in our community. So it's basically raising awareness on the real threats of COVID-19 amongst members of our community. We wanted to, I think the history is that we were contacted by our borough leaders, and then they said that the Bame community, they wanted to support the community in terms of helping the community to reduce the risk that we face. And in order to be able to do this, they need leaders within this community, this group, to raise awareness amongst the community themselves. So, and that's what brought us here. And that's what got us engaged in this event discussion tonight. So can I please ask that we just observe a 1 minute silence for those in our communities and in every communities that have lost their lives during this COVID, just to, acknowledge and to pay our respects to them. Thank you. Okay, thank you. I'm not sure if that's what 1 minute is up. And again, because we are a Christian charity, though we are supported by the Harrow Council and the community of Harrow, we also do believe in prayers in terms of praying for those who have lost loved ones, who have been impacted negatively across all communities. So I'll just say a 1 minute prayer for everyone who have been impacted negatively. I know that there may be people who are not people of faith or who are of other faiths. So, but because we believe that spiritually as well, we can support people in their moments of griefs. So we will be just saying a minute prayer. So can I just ask us to just be silent while I just pray? Father, Lord, we want to thank you this evening. We appreciate you, oh God. Lord, we want to bring everyone who have been impacted negatively, who have experienced loss during this COVID pandemic in our community and across all communities in the United Kingdom. Those who are grieving, those who are in pain, those who may not be part of this situation, everybody, wherever they may be. Lord, we ask you to do this for everyone, Lord. So, talk where I know who also it's a when we have another conversation event evening, we might attend here for discussion on vaccination. Okay, right, next slide, please. We'll just quickly take us through the slides to show us, okay, so why Black and South Asian people in the UK have been hit the hardest by COVID-19. What are the reasons? Statistics before us, the situation in the UK as of June 2020 says that we had 3,876 deaths among the Black and minority ethnic groups. And that the Bame group, is made up of 15.5% of the entire population of the UK. And then from the Office of the National Statistics, they said it may be as much as 15.4. So we see the slides here, the graphs is telling us the disparities between the Bame group and the white. We see here that for the Asians, the population is 7.8 and the impact is 7.2. For the Black, the population is 3.7 and the impact is 5.1. So you can see that the people of color or the Black people of color have been hit hardest. And then we follow others and mix. We were told that some of the highest deaths and hospitalization rates during the outbreak was in London, because 40% of the population were from ethnic minority. That based on the hardest hit population, there was a study carried out by the ONS, the Institute of Fiscal Study and the Public Health England, and they also concluded that the Bame community were disproportionately impacted. And then they said that the Black African Brits face triple virus death rate in geographical factor. However, when we bring that aligned with geographical factor, it's counterbalanced by the factor of age. So when you look at it geographically, then you also have to age has impact. Then most minority groups are much younger on average than the white. So in the Bame community, our groups were much younger than in average than the white, and therefore should be less susceptible to this virus. Then the question we'd like to answer today is that, then why are we hit the hardest if we are younger and should be less susceptible to this virus? Next. The predicted impact of coronavirus, this is prediction that the Africans are 3.7 times higher than most other groups. The Pakistani, we see 1.8, the Caribbean people, 1.8, Africans 3.7, Pakistani 2.9. Next slide, please. Okay, so this particular slide, I want us to quickly pay attention. It says the ONS research other factors such as health and deprivation. And it concluded that Black people are 1.9 times as likely to die as white people, just from any other, apart from COVID. We see the Bangladeshi and the Pakistani 1.8 times, and the Indians 1.5 times. So if you see the arrangement in terms of the levels, and then we want to do something to bring this down amongst us. So analysis from public health showed that once in hospital, again, people from the Bame background were also more likely to require admission to intensive care units. Then the question will be why? Is there something we can do about that to bring that figures down? People from the Bame community accounted for 11% of those hospitalized with COVID-19, but over 36% of those admitted to critical care. These figures are figures that the ONS have produced themselves. We also found out that the South Asian people were the most likely to die from coronavirus after being admitted to hospital in Great Britain. So this study was taken from 35 COVID patients across 260 hospitals. And you can see that it was a large survey that they did, and their data were collected extensively. Okay. So here we are, percentage of workforce by ethnicity. So what are some of the reasons? Black and ethnic minority individuals make up a large share of jobs considered essential in tracking virus. In other words, we make up a large share of the jobs in the NHS. And let's move on, please. And then we can see the other type of job is people job that we the jobs that we do from statistics, from research, is that we are more in people face contacting job, like taxi drivers, shopkeepers, security guards, care workers, bus and coach drivers, nurses auxiliary, bookkeepers, cleaners, domestic, postal workers, elementary storage occupation, vehicle technicians, all these jobs that exposes us to meeting with large numbers of people. So which automatically puts our community in a disadvantaged position. Okay. Okay, people, and then another reason again is people in multi-generational household have higher COVID risk. You know, in our community, we live with our elderly. So a neighbor, one of my neighbors, yesterday I met her in the park, and she was telling me that her husband's elder sister, who was healthy, no underlying issues, was not on medication, has never been to hospital. She was 81, but she lives at home with her children. And one of them got it, brought it home, and within 10 days, she was dead. I mean, that's just my neighbor down the road. So multi-generational household. So what we are saying is, you know, it exposes the risk more because we live in groups. Okay. So living more in urban or depraved areas affect risk because we live in urban area or in area that are not as flourishing, if you want to use that word, or depraved in terms of services, or the standard of living in those areas may be lower, and then exposes people to the risk of COVID. Next. Having a garden is less likely for most people of Black ethnicity. This is one of the census, the result from the census in 2014 to 2019, I don't know. So most ethnicity, if you look at the graphs for the Black people, we don't have access to gardens. So again, having access to outdoors where you can have air can also protect you being infected. Okay. Now, what will then be the actions to be taken to protect our community? That brings us to the government protocols. Why should we take it seriously? Is our community, we know that this virus is out there. We know that it's affecting people. We know that it's impacting people. We know that it has been proven that we are impacted disproportionately. Then how are we going to look after this community, look after ourselves, protect ourselves, protect our families, protect the community, and then protect the NHS? We are encouraging everyone to follow the government protocol. In other words, to wear the mask wherever, maybe in public spaces, wherever it's needed to be worn. We wear those masks. We take all the precautions according to the government protocols. We wash our hands. We keep our distance. We ventilate our homes, and we clean our environment. We keep the social distancing, stay 6 feet away from others. We avoid inside. Can we go back to the slide before this one? We inside your home, you avoid close contact with people who are sick or people who are vulnerable. If you live within a multi-generational household, you take precautions. The younger generations should take precautions that when they come in, they wash their hands. They take precautions even in the community, also knowing that they have elderly people in their homes. Outside your home, you obviously, we have said stay 6 feet distance, keep your distance. Next slide. Avoid crowd and poorly ventilated spaces. Being in a crowd, like in restaurant, bars, fitness center, or movie theater, you know, for now, puts you at risk. Avoid indoor spaces that do not offer fresh air from the outdoors as much as possible. If indoor, bring in fresh air by opening windows and doors, if possible. Okay. So these are all the: wash your hands before eating or preparing food, before touching your face, before using the restroom, after leaving a public place, after blowing your nose, coughing and sneezing, after handling your mask, after changing a diaper, after caring for someone sick, after touching an animal or a pet. All of these things would help to limit the exposure to the virus. It's better to use soap and water all the time. Okay, if we are coughing, we are to cover our mouth and our nose, use tissue, bin it, then immediately wash your hands. Okay. So yes, so we've talked about all of those disinfect. We've talked about all of that. Then the next thing is that get tested, even if you don't have COVID. If you are in public space, then there's a free test that you can get tests as regular as you want. Okay. Before we take the roadmap out of lockdown, I want to invite questions. Is there any question from our audience? Any questions for our audience, either medical questions, or any of the reasons that have been listed by the ONS and public health of why we were impacted negatively or disproportionately. So please, if you have any questions, can you raise your hands? It's discussion time. Thank you. Any questions or suggestions of what we can do to literally protect ourselves? Or okay, let me invite Dr. Wumi to come in at this junction. Is there any suggestion among the reasons for why we are disproportionately affected? What would be your advice to us this evening?
Thank you so much, Ma. And good evening, everybody. It's nice to be here today. Thank you so much. It's really sad to know that COVID-19 has impacted the Bame community the hardest. And then from the slides, we are like 4 times, you know, the COVID death is like 4 times higher among the Black community, and like maybe 3 times higher among the Asian community. So it's really sad to hear this. So being in this meeting today, I think is a very good one to see what can we do, you know, how can we, what can we change, you know, to help reduce this impact. So this meeting is a very, very good one. And I think it's one of the ways the government is trying to, you know, get across to the Bame community to see what help can be rendered. So from all that has been said, the socioeconomic factor is the number one thing that I can say that has been looked into. As an African person and as a BAME, we cannot say that research has not looked into genetics. Is there anything in us? Is it the gene in us that is causing this? But we don't have any evidence or any research, any concrete evidence from that aspect. But the social economic factors that has been listed earlier on, those are the main ones that has, you know, negatively impacted our maybe I would say our health, and making us to be able to fight the infection. Okay, factors like our housing, the densely populated area that we live in, and the kind of jobs that we do, you know, public facing, jobs involving contact with people, bus drivers, taxi drivers, security men. We work in, you know, low income job. We work in restaurants, in pubs, and all. So all these are public facing, you know, jobs that you can't even, when they put the lockdown, it's not something that you can do from your house. You know, it's not the kind of job that you can do from your house. You still have to go out. And also jobs. I think I read it like 44% of Bame community work in the NHS. And so these are the kind of job that will expose us to people that even have the infection already. So part of social economic factors that we're talking about. And also, as a BAME, we are most likely to have to be obese, you know, to be obese, to have hypertension, to have diabetes. And it's really sad that you know, we don't, compared to our white counterparts, we don't see our doctors. We don't go for routine checkup, even when they call women for breast cancer screening or cervical cancer screening. The number of people that come out as, you know, it's quite low compared to the white counterparts. So, which is really sad. So, you know, those are part of the things that make us to be more, you know, affected by this virus that we are talking about. I don't know whether you want me to keep talking or to say anything.
Yeah, it's very interesting. Maybe you know, what I'm saying is that Thank you very much for observing that as a medical practitioner yourself. How can we encourage ourselves to access what is available? So we're talking about COVID-19 now. For all the socioeconomic reasons that were listed, is there anything we can change moving forward? What can we do?
Yeah, in terms of the occupation that I talked about, one of the main things that we need to do is we need to engage with the risk assessment that has been put in place at our place of work. The risk assessment. Yes. Sorry. That's it. Yeah, that's my children. The risk assessment, that's at our place of work. Let's engage in it. Let us not just ignore it. Because when we engage in this risk assessment, then you know whether you are, at high risk or low risk, and they may be able to redeploy you, depending on the kind of job that you do. They may be able to redeploy to another department that that you will not have to face maybe the public. Another thing is the provision of PPE. We need to make use of it, at our places of work. Don't ignore it, use the PPE that are available. And when they are not available, then we need to speak up to say, oh, you want me to do this job, but the PPE is not available. Please, can I get, or when you feel that you don't feel safe at work, we need to speak up. We need to speak to our manager to say that, oh, I don't feel safe enough, instead of us just keeping quiet and just carrying on with the job and continue to expose ourselves to unnecessary risk. So that is in terms of, I'm talking about the jobs, the occupation at our places of work. Those are the few things that we need to do. And also washing our hands regularly, it's very important. Very, very important. We don't just ignore. I think most times we think that, oh, we just have this nonchalant attitude sometimes that, oh, no, it won't come near me, or it won't come now. And we ignore those things. They're very important. Use the PPE, wash our hands regularly, and just follow the protocols, at our place of work. And if we think that, oh, at my place of work, you don't feel safe enough, then we need to speak up. We need to speak up. Most times as Black person, we don't talk, even when we think it's not right. We just carry on, and which is negatively impacting us. So
thank you very much. We appreciate you, because today really is to see what we can do. Self-help is the greatest help of all time. Rather than waiting for other communities to come and help us, you can see that for us, even as Black ethnic minorities, we are at the top of the deprivation ladder in terms of how this is impacting us socioeconomically. So we will probably need to take power back in terms of doing something for ourselves that will help us reduce the risk that we currently face. Okay, let me hear from thank you, Dr. Wumi. Let me hear from Dr. Aino.
Hello, everyone. Good evening.
Thank you, Dr. Aino. Yeah.
As you heard, Tokpa is my name. I work in Northwick Park Hospital and in the neonatal department. So in event, I actually look after very, very, very small beings. So like my colleague has said, what I think one of the things that is affecting us is that the stressors in our lives as Black people is very high. When I say stressors, there are things that that can bring stress. Everybody needs a level of stress to be able to function well. That's how we are. We need something to push us. But when these stressors, when they are too high, then they can affect us. And one thing that is well known is that when somebody is stressed, it can affect the immunity of that person. And because of the kind of people we are, and then because of the kind of where we come from, the kind of culture that we have. We live in communities. We want to, be together, and then we want to help our families, our friends, and most of us on this side of the world living here, that has become a burden on us. And at times, I think we take it to very, very high level that it affects our health as well, because we carry all these burdens. Our immune system cannot really function the way they should. And then what will happen, is one of these things that we have seen during this period. Because I know that COVID can affect anybody, but someone whose immunity is not even there, or is being compromised, then it will be more difficult for that person to fight off, this kind of disease. So, and what the things that put more stress in our lives are those things that have been mentioned: socio-economic deprivation. There's so many things that the white people, they don't have to think about, but we worry about, because of probably where we are coming from, or because of probably our family background, what we need to do, so many expectations, upon us, or either from our family, or that we feel that we have to. So we, in other words, we put upon ourselves to carry. And those are the things that can affect our immunity, and then they can, in a way, expose us and make us to be more to be affected by all these things. So that's the angle I want to look at it from. I know you will agree with me. I discussed with one of my colleagues. We tend to want to work hard. That is the kind of nature we have. We work very hard, but it's like there are times that we don't know when to stop. We just keep going and going and going. Even when we don't feel all right, we still go. Our white counterpart, if they are sick, they will say, well, they are not coming, they are sick. But we will still go. Sometimes because of our belief, sometimes we feel like, oh, for those of us that are Christians, oh, well, I will faith it, like we say. And that can affect us, because like I tell people, what you can achieve by obedience, God is not going to do a miracle. If you know that we are, at the end of the day, we are human beings. We are, we have limits, and we should have time to rest. Some of us, we don't take rest. We don't rest. We work, even when we are off from where our working place, we still go to another one. We still continue working, and all those things, they can affect us. In fact, more than we think. Because, and then another thing is that because most of the time, I know people, they'll look at me and say, oh, you are very young. And I just smile. So God has given us, the kind of nature that people don't tend to know how old we are. So, but our body is not like maybe 10, 20 years ago, but we still want to do the same thing that we're doing 10, 20 years ago. And so we need to start, looking at ourselves and say, well, no, I don't have to carry I don't have to carry the burden of the whole world, because sometimes that's how we feel, because of our culture, I believe. But the thing is that at the end of the day, if something happens, that whole world, the whole world that we want to carry will continue, and our own has ended. That's it. So those are from that point of angle, I think it really affected us, especially those working in hospital. Because of that nature, because of the burdens we're carrying, sometimes when we're not supposed to be working, like my colleague said, we keep working, we will not talk. Sometimes because we fear that if we say something, then it will backfire, and then they will use it against us, but we need to talk. It is better to be alive than to be dead, because of, we feel that somebody will If we say something and then it will backfire and then we will lose our job. What if we die? That job will leave us at the end of the day. So we need to understand that we cannot continue to do things the way we do again. We cannot. We need to change our mindset. Yes, we should help people. We should help our people at home, but we need to know that how far we can go. We will not do it at the expense of our own health. So we should take things easy. I would say most of us, we don't. It is true, we don't. We should take things easy so that we can prolong our lives. In terms of even all the things, all these health issues that one of the reasons why we have, because we are not taking care of our body. We think we are strong. People believe that when you're a Black person, you are strong. No, at the end of the day, it's still flesh and blood. Therefore, all those things, like my colleague said, we need to check ourselves. Some of us, we don't. We need to check ourselves. If we don't, we won't even know what's in our body. And then suddenly, the other time, one of my colleague, the son, about 40 years old, just fell and just dropped dead, just like that, nothing. We should be checking ourselves. We should not just keep going and assume and think that we are healthy. Yes, that's what we want, but we need to. Because if we don't know and something happens, it will affect even our families as well. But if we know, we can start taking precautions. And then when we know what is wrong with us at our workplace, like my colleague said, you can go and say, oh, this is what I have.
Okay.
I cannot continue with this because my health cannot, accommodate this kind of job. Like your manager will look at, because that's the right thing to do. That's what they must do. If we don't talk, most of the time we don't talk, and it backfires on us. Let me stop here.
Okay, thank you very much. From the audience, any question? Because it's supposed to be a discussion forum where we can help ourselves. It's indeed not so encouraging that we are at the top of the deprivation ladder. It shouldn't be so. Health-wise, we know that there are other factors apart from socioeconomic factors. We know that we cannot take away also the factor of racism in terms of medical care and in many other areas. But having said that, what else can we do to help ourselves? That's the reason for all of these forums. And we have heard, and I thank you very much, Dr. Aino. It's very true. Yes, we kind of like say, oh, maybe some of us that are Christians, we say in the name of Jesus, it will not happen to me. And then we don't go to we don't go for checkups. We don't follow things through. It is good to have faith, but also we need to follow things through. Anybody on the audience wants to ask any question, please? Our panelists are here to answer it. Audience, if you want to ask any question, can you put your hands up? Or you, from what has been listed, you have any advice that you want to give us? Well, we don't like quiet audience. We want everybody to participate. We want people to participate. Okay, all right. So yes, we have somebody. Okay, my wonderful assistant wants to say something.
I just wanted to ask.
We can't hear Okwe.
Can't hear.
Okay, hi. Can you hear me now?
Yes.
Okay, sorry. Good evening. I said can you hear? So I've grown up on having it's echoing. Can you reduce your volume? So I've grown up on, okay, yeah, better. So I've grown up on having like yearly checks in Nigeria when I was younger. And then when I moved here, I asked my GP that I wanted to just get like a general health check, just to check every single thing, but they don't do it here until there's something wrong with me, or until I have a pain, or I have something, an area or issue. And I don't know what to do in those kind of situations, because they are, in terms of my vitamins and some other things, they always fluctuate. Me, I've always known that growing up, and it's always been an issue. But here, when I do go and tell them, okay, I'm feeling funny, well, I like, are you sure? Like, just have this, just take this. They don't do the health check until I feel really, really, really bad. And by the time they check it, that level or my vitamin level, or that particular thing is very low. So I don't know, what can I say to my GP to like maybe take me seriously and be like, okay, I want to have a general check. Or is that possible? Can we have general health checks here in the UK? Is that possible? Is there something we're meant to say that they would answer us? Okay, that's what I wanted to ask.
Dr. Wumi, can you answer, please?
Okay, thank you for that question. Yes, we need to understand that Nigeria is different from UK. Okay, and here there's so many investigations. So when you go to your GP, you can't just say that, oh, I want a general checkup. They will ask you what exactly is wrong with you. Okay, so like you mentioned that, oh, I have low vitamins. If you tell your GP that, oh, I used to suffer with anemia, or I have low vitamins, then your GP would check for that. Okay, so you can't just say that, oh, I want general checkup. The basic thing they would do, maybe check your blood pressure, then check your pulse and listen to your heart. But you need to tell them something. Tell your GP the reason why. If you tell your GP the reason why, you present it well, then your GP will be able to know what kind of investigation will be done for you. And it also depends on your age. Anytime from age 40, we always say that if you are age 40, you need to come in for a checkup. So for that age group, we know the specific things we do, the specific blood tests, because we know we are anticipating that at that age group you are prone to, it could be diabetic, hypertension, all like that. So we check your BMI and also when you go to your GP, try to be more specific. That will help your GP to channel, to be able to and request the right investigation for you. I don't know whether I've answered your question, because when it comes to investigation, there's so many things, there's so many investigations, but you have to be a bit specific. You need to tell your GP your concerns about this, then your GP will know how to deal with it. I don't know whether I answered that question.
Hi, yes, Ma, you did.
Okay,
Thank
you.
Okay, so bringing us on to COVID-19, yesterday I was reading an article of the pregnant woman who died. I think she was from Ghana. She was very pregnant and she got COVID and she was in hospital. The doctor sent her home. And 2 days later, she was rushed back to hospital, but she died during childbirth. And the husband is asking Boris Johnson to investigate. We have known that sometimes when we present for a particular issue, that I don't know what it is. There's another pastor, a clergy wife that we know in our mission, who went to A&E 2 times. And on both occasions, they discharged her. By the 3rd time, she dropped dead at home. So we have that issue with the health disparity. What would be your suggestion, Dr. Aino? I mean, because the husband was saying, as I was reading the article yesterday, that when she saw his wife. He was amazed. Why was she sent home? Why was she discharged? So I was saying, if I was feeling that way, even if the doctor discharged me, can she not insist on staying?
Um, well, I want to say that it's not, sometimes it's not very straightforward and it's not very easy. And there are times that I understand what you said, Ma. There are times that when a patient presents, um, because at every point in time, it depends on that moment in time, that point when that person is being seen. And I'm sure that they would have. And the truth is that you say, there's no way, we are human beings, we are not perfect, we are not God. So there will always be one or two that will be missed. That's just how it is. I'm not saying that. So it could be anybody. It could be anybody, no matter how we try. Because when someone is being assessed at that point in time, that assessment may not trigger. It depends on the level, a kind of level that you may even think it is. So at that point, and the other thing that we also need to understand is that when this coronavirus started, we don't know many things. Many things about this coronavirus, we had no clue. We didn't know what we were dealing with. And that really affected many people that time when this thing started. Because the doctors, they didn't know what they were dealing with. So I'm sure that it affected so many people at that point in time because it was new, nobody knew. Like one of the lady, a nurse that also died, unfortunately, went to the hospital. I heard in the news, and because the symptom that she presented with was like a pneumonia, chest infection. So they just gave antibiotics because at that point in time, nobody knew that this thing is more than that. So, and I'm sure that many people will have been affected because of that. Because if it's, if we think it's pneumonia, what we use is antibiotics. And as far as that illness is at that point in time, it's been covered. And then if it's not the protocol, because in hospital we have protocol that at that certain time, that person does not warrant admission into the hospital, that person will not be admitted. So we escalate things, depending on how patient present, so there's escalation protocol. So at every point in time, if that person does not meet, it cuts across. It doesn't matter whether it's, but the thing is that at the end of the day, if we don't feel well, then we need to, we need to go back. We don't need to say, oh, okay, I've been to the doctor and they said there's nothing. Or sometimes what I find is that if I go, they won't do anything. Some people will say, if I go, they won't do anything.
Yeah, they won't do anything.
But we shouldn't do that. We should just still go, because that's assumption and it's not going to help us. We are the one that are suffering. So we need to go back. It doesn't matter 2-3 times. We should need to go back. But unfortunately, because we are not all in all, we are not perfect. We are not God. Some people will still miss, will be missed. Unfortunately.
Thank you, Doctor. Thank you very much. But the statistic we have before us is that those of us from the Bame group, we are disproportionately affected. Yes, people are being missed. Even if you bring it down, we don't want to deviate from COVID-19. If you bring it down to maternity care, it's been on the news the last week, and in what's called London Biggest Conversation, LBC. They were, people, especially from Black minority ethnic group, were calling in to to talk about their horrible experience in maternity wards. So it's not just about COVID. Well, maybe it will be another matter for discussion on this platform. But what we are dealing with tonight is how can we protect ourselves? Because when you have a situation, I think one of those statistics said that we are more likely to be, people from our community are more likely to be in critical care, go for ventilation than any other group. So what we are saying is that we don't even want to get to the place of ventilation. We don't even want to get to critical care. How then can we help ourselves? And that's why the COVID protocol, we cannot, what's the word? We cannot just say it does not exist, because I don't have anybody in my home that have been affected. You know, people across nations have been affected. And so nobody knows who is going to pick up that virus and when and where. So it is not too much to, you know, when you go into the supermarket, as soon as I have a sanitizer in my car, as soon as I get into my car, I put my sanitizer on, even my keys, I will have to sanitize it, sanitize the doors, do my hands. And then when I go to the house, I unload, I wash my hands. It's not too much to continue to do that, because you don't even want to experience it as much as possible. So that's the encouragement that we are giving here tonight, that the protocols, we should use them for our own protection, for the protection of our community, and not ever to even go to the NHS in order not to experience disproportionate treatment. Yes.
Can I chip in one or two things? So I was reading through some articles and you know, also some stuff, and what I found is that and this is my own personal view now. Many times when we look at especially like in China, because everybody says it started from China. And my question most of the time is that why is it that they did not die as much? Why? Okay. What happened? You see, many times we tend to disregard everything that comes from that side part of the world. You say, oh, they are not telling the truth, this, you know, this kind of thing. But have we really sat down to look at how they are doing their own thing? Can we learn from it? Can we implement? And I argue with people that if you have not done what they said they did to get the result they got, then you cannot now come and say that, you know, is a lie, until you have done the same thing they said they did, and you did not get their result, the kind of result, then you can criticize them and say, come, you know, how can it be? Someone said, you know, before now, there's been bird flu. It affected them more on that side. And one of the things that somebody, you know, raised is that they are used to wearing masks and all these things on that side of the world. If you look at the Asian part of the world, it's not, especially the, you know, they were not that affected because they've been dealt with, especially with the bird flu. So they know how to deal with this kind of a thing. They are more likely to wear their mask. In fact, I remember during the time of this COVID last year, when I went to pick my son in the airport, some of them, they came in the whole regalia of PPE. I don't know where they were coming from. You know, they were prone. They tend to obey all this. Wear your mask. They did it religiously, more than we do it here. We tend to be like, oh, the government wants to control us. We cannot breathe. We cannot do this. But the thing is that it works. Wearing face mask, it works. So many experiment has been done. How when people talk, you see, we won't see it, but they put all this in under electron microscope, and you can see how all the aerosol from as we speak, the saliva, how the thing, shoots out. And then they've done it with mask and without mask. So it works. If only we can just, I know people feel, I don't know, burdened wearing mask, but it works. If something works, then we should try and do it. It will prevent us, like you said, even getting to that area of even attending, going to the hospital. If we can just do it, it may be uncomfortable, but it is better to be uncomfortable than to be dead. It is better. So I will advise that as much as possible, we should. If you feel like, oh, it's uncomfortable, you can go out where there's air and remove it and, and then put it on back. But don't say because then you just throw it away and not use it. No. And then when we know that all these things affect us more, the more reason why we should be, using things that will protect us. It's
Very
so
true.
vital.
Very true.
Thank
We
you.
have just 5 minutes. Thank you very much, Dr. Aino. Thank you so much, everyone who attended. I have Adebimpe here, her hand up. She wants to ask a question or speak.
Yes. Thank you very much. Good evening, everybody.
Good
And I want to
evening.
thank the organizers as well as Dr. Ojo and Dr. Aino for enlightening us on raising awareness on the COVID-19 protocols within the Bame community. First of all, I want to say thank you to all the doctors. Like Dr. Ojo said, a lot of Bame are doctors. When you go into the hospital, I think in the UK now, 1 out of maybe 10, you'll be surprised, are actually Bame. So they are doing, I think I can say that they are doing a very good job. And we are well represented. But I think, like Dr. Ojo said, when she mentioned the socioeconomic issues that we have, as well as Dr. Aino mentioning, when he mentioned the stress factor, the stress that we go through as BIM, how do we educate ourselves? Do we like going on holidays? No. Do we eat properly? No. Instead of taking the bus, or, there are certain things that you wonder, why should somebody, like you said, work so hard? Dr. Ojo said that, you are saving for what? For somebody else to come and use that money. Some people are in the UK, they've not gone on sightseeing, So how do they distress? Because every community has a stress. I remember during the lockdown, if we look at where we come from, Nigeria especially, everything was on Zoom. It seemed to be, if they want to do a naming ceremony, it's Zoom. If they have a new puppy, it's Zoom. And they expect you to be part of that Zoom. I had Zoom fatigue. Then one day I made up my mind that you don't have to attend all that Zoom because it was giving me stress. Like Dr. I know is saying, do you understand? I don't have to, the fact that we're on lockdown, the fact that we are home doesn't mean I have to be on Zoom for everything that everybody wants to be on Zoom for. Multivitamin Zoom, just name it. Everybody had a Zoom, apart from the parties, everybody just had something they wanted to talk about. So, but for me and Dr. Ojo and Dr. Aino, the main thing is, sorry? The main thing is,
we have those.
Yes, how do we, we are talking about because we haven't got the message yet. You've talked about PPE. You've talked about, the fact that the way people wear their mask, we are most likely, the ones that will put it under our chin, because we haven't got the message. We are the ones that feel you can't come near us, but the statistics don't lie. The demography is saying, BAME, they are dying. And you still believe that it cannot come near you. So I think we haven't got the message. So maybe in your various organizations, you can ensure it is broken down so we can understand it. Let me tell you, even the media, they were not putting up BAME until very, very late. And if they showed the people that died, because there was a time every night they were showing people that died, then that's when we realized what's happening here. BAME are dying. Initially, we didn't hear about it. So that has to do with the media too. So we have to come up there. You have to write, I don't know, a simple terminology that my grandma, my mom who is 80-something would understand, either she's living in UK or not. Somebody that is 17 will understand, like Pastor Efe said, a child takes it home. Once we can understand that properly and know that that's the route of transmission, because people don't believe that that's the route of transmission. And you are saying the simple mask can help us. And so I believe that you should say more, more public enlightenment. How often do we change the mask? Do you wash it? Should you use disposable ones? Are you using fashion ones? You find some people, it's not fashion, this is life and death. And it's a shame that Bame are the ones doing it. Thank you. Sorry, because of the time, I don't know. Thank you for listening. I'm so passionate about it because, people are dying. Thank you.
Thank you, Adebimpe. We really appreciate you. A point that you really picked there, how often do we wash it? Is it fashion? Is it fashion? I don't even want to say mine. So that would put me back now to going to try and disinfect and wash regularly. Let me just read a question here that was asked. Somebody said to Brother Tokbe and Sister Wumi Ojo, how detailed or comprehensive is the usual preliminary analysis performed by the NHS? We expect proper due diligence to be performed while examining symptoms of patients. Is treatment administered based on face value of the patient's symptoms, or proper diagnostic is performed for both COVID and non-COVID related symptoms? 1 minute to answer that, please, Dr. Wumi.
Okay, thank you, Ma. I will say that anytime we go to see our doctor, whether we go to the hospital or we go to the GP, let us see exactly what is wrong with us. Don't assume, don't push one or two things behind and say, okay, let me just mention one and don't say the others. Just say everything that is wrong with you, because that is what your GP or your doctor is going to work with, okay? It's the same for everything. We take the history, okay, and then we examine you properly based on what you have told us, and then that's the investigation we follow. But when you don't say, maybe sometimes I think it's just because sometimes we don't say it all. We think some things are not necessary. Don't let me say this one. Let me just say this one. And it depends on what you tell the doctor, because the doctor, like Dr. Ojo and Dr. Aino said, we're human. So you need to tell us, and then we will ask you further questions based on what the information you've given to us. And to be very sincere, we treat people the same way I treat people, whether white or black, but depending on what you tell me, take the history, we examine you, and then we put forward the investigation that is expected to be done. But I will say again that in case you're still concerned, or you're still not feeling very well, or you still feel that something is still missing, always go back to say, even if you have just finished seeing the GP now, and by the time you are leaving, you are still not convinced that the GP understood you, book another appointment there and there, and just tell the receptionist, I think, can I see another doctor? So yes, the white counterpart, they do it. So you can say, oh, I'm not very happy with the way the doctor, talked to me or treated me. I'm not convinced she listens to me. Can I book another appointment with another doctor? It's acceptable. And then you will see, or can I have a second opinion, like they normally say in the hospital? I've seen this consultant, I'm not happy. Can I have a second opinion about my condition, because it's my body and I'm not happy with what the person has said? I think with that, doctor, I don't want to say anything.
Well, exactly as you have said. So I'll say in this way, we do the due diligence when we see every patient. But in hospital, the thing is that sometimes we may think, oh, they did this for this person and they didn't do this for me. That is very common. People compare. When did you go? And then, in fact, what I've learned is that some people will tell others that, tell them this. If you tell them this, they will do this, But at the end of the day, we are not the same. It's not you may think that, oh, it looks like, but at the end of the day, it may not be the same thing that is wrong with us. So we need to be careful. We need to all have open mind. And apart from that, some of us, we already have this mind that they are not this hospital, or these people, they are biased. So even before we get to the hospital, we have this kind of, our heart is, no matter how, we don't trust. And I know that because many people, because of the experience they have had. But please, let us have open mind. If you are not happy, you tell them that I am not happy. or if you don't understand, and that's another thing, many times people don't understand what is happening and they don't talk. Please talk. If you don't understand, excuse me, can you break it down? I don't understand. I am still confused. You need to talk. Let them break it down to you the way you will understand. If it means that person will call another doctor that may be able to break it down, so be it. But if we don't let us not leave the hospital when we go without having understanding of what is going on, because I see that a lot. So if you don't understand, please ask until you are satisfied.
Thank
And
you
again,
very
sorry, can I just chip this in, please? Just
Yes.
very quickly. We Nigerians, African, let me say, like Dr. Aina said, if we don't understand, let them break it down. If you think that we don't understand English very well, tell them the language that you understand. Tell them the language. They will get an interpreter. They will get somebody that speaks your language. That is what this Asian community, they do. In fact, the moment you call do you speak Punjabi? Do you speak Hindi? But I have never since my practice here, see any Nigerian, ask me, doctor, do you speak Yoruba? Do you speak Igbo? I have never. Even when you are, obviously they are struggling to communicate, they will not tell you the language. They will just assume. So when you think, this English, I don't think I can express myself very well. Do you speak Yoruba? Do you speak Igbo? Do you speak Hausa? Ask. We have a language line. We have an interpreter that will be able to, that you can, when you talk in your language, the person will interpret to the doctor, and the doctor can, say whatever I want to say. We understand properly. Okay,
thank you very much. I have an 80-something-year-old woman who uses the NHS. And of course, when she goes there, she can only speak Pidgin English. And most of the time, they don't understand her. And we never knew that we could call somebody to. So thank you for this enlightenment today. Thank you very much. I think we need more of these sessions because I'm not truly, it doesn't feel as if I am satisfied that I've eaten and I'm full. So 7 o'clock, we said we'll not bring this to a close. Everyone else, can we vote? We have 3 of this session once a month. So if you can let us know if you would like us to put this session together again and we can continue this discussion. There must be something we can do for ourselves to bring down the level that is currently where we are at. From the statistics that we have, we've really not treated them individually. There are things we can do. Those socioeconomic things, there are things we can put in place to change them, even for us or for our children, to begin to explain to them. We need to really change these things around. And so thank you all for joining us today. We appreciate you. Please leave your comments so that we'll know how well we have done. And if today's have been helpful, please let us know. Thank you all. We really appreciate you. We don't want to be calling names, but we see all of you here. Thank you so much for taking the time to come. We do understand that this forum is for everyone, faith and no faith. And so again, as we said, it's a Christian charity. We want to quickly just say a quick prayer before we close. Father, we want to thank you for this opportunity that you have given us. We thank you for what we are dealing with. Lord, we pray that every information we need to change the statistics to be positive to the Bame community, please help every one of us to be engaged. Help every one of us to do what we have to do to bring this negative disparity down into positive. Thank you, Lord. We pray that you bless everyone who attended tonight. Thank you, Heavenly Father. In Jesus' name we have prayed. Amen. Thank you very much. There's a COVID event. Somebody says there's a question there. Can you say yes or no? Would you like this session to hold continuously? We are only suggesting 3 sessions. We've had one today, another 2. Yes or no? Please submit, and we appreciate it. Thank you. Thank you so much. So if you have submitted, we want to say thank you very much. We'll see you again next time. We'll inform you when the next session will take off. Thank you, Dr. Wumi, and thank you, Dr. Aino. We really, really appreciate you educating us today. Yeah, thank you so much. We appreciate all of you. Thank you.
Bye-bye.
Thank you.
Goodbye, everybody.
Bye.
God bless you. Thank you.
Bye.
Bye-bye.